Well, we've been partnering with the Ozark Orthopedics and learning all about the procedures the doctors are doing to get those with injuries back on their feet.
That's right. This week we're visiting with Dr. Andrew Heiselman, talking about a few options to remedy any shoulder pain you may be having. Take a look.
Well, my cheerleading days are far behind me, but you know, every now and again I get a little stiff in my shoulders, and that's where Dr. Andy Heiselman comes in. We are back at Ozark Orthopedics. How you doing, Dr. Heiselman?
I'm doing well. Thanks for having me.
Tell us about your specialty.
Well, I work a lot on shoulders, shoulder surgery, athletic shoulder injuries, traumatic shoulder injuries, and arthritic conditions of the shoulder. Also do some sports knee surgery as well and treatments. Basically, age groups from adolescents all the way up to the older population and everywhere in between.
How do patients know when they should come see you, Dr. Heiselman? If I have like a little bit of a pinch in my shoulder, when do I know when I need to come seek a professional like yourself?
Yeah, I mean, most of the patients that come see us they have pain. Okay, pain and dysfunction, but primarily it's pain. And oftentimes it's gradual. So there'll be months of time where they're kind of like, I tweak my shoulder, it's kind of bothering me, then it becomes more persistent, and it's common that they can't sleep. They have night pain, activities of daily living are painful, changing clothes, doing routine work. Now, there are other injuries that are a little bit more traumatic, a little bit more obvious, something's wrong, and you probably need to be seen and x-rayed and those kinds of things. So those are the good times to come in. Give it a little bit of time, but if it's not getting better, several weeks, months in, it's probably worth being evaluated.
What are some things we can be doing maybe when it comes to our shoulders to kind of maybe relieve pressure or stress on them?
Well, I mean, staying fit, if you are having shoulder pain, say you're working in the yard and you're using yard clippers or something like that, and you find that every time you're reaching and lifting out away from your body, you're experiencing discomfort, those might be things to avoid, starting a lawnmower, those kinds of things. However, it becomes interesting over time if you start eliminating all these things from your life activities. That's another reason that people kind of, something's wrong here. I'm not able to do my normal activities, the things I like to do, if I want to play golf or ride my bike or work in the yard.
So say someone does have to come see you for a procedure, what kind of procedures are available?
Well, there's really two different kinds of procedures that we do, say, for shoulder surgery. There's kind of an arthroscopic, minimally invasive type approach to certain problems, and it's problem specific. But as we get a little older, the open procedures, we start thinking about some arthritic conditions in the shoulder. And then when we, in traumatic injuries like fractures or broken bones, sometimes those we'll do an open procedure with plates and screws, put the bones back together, that kind of thing. And that can happen at really any age.
Sure. What is the recovery and rehab for someone who may have to have surgery?
So for probably the most common thing that I do is rotator cuff repair surgery arthroscopically. So the patient may come to the office, they're complaining of pain, we start determining how long has it been going on, what was kind of the injury, have they had any treatment prior to that. So we'll come in, we'll get radiographs at the office to kind of evaluate, do an examination, and determine if they're symptomatic enough and weak, then we will often order an MRI scan. If we find that they're a surgical candidate, then it's we assign surgery. It's outpatient. They go home the day they get it. You're in a sling with a little pillow for about 4 to 6 weeks, where you're not really able to lift or use the arm much. You can use your hand and your fingers. And then over the course of the next couple of months, so really like 3 months, you're kind of rehabbing the shoulder. But light activities of daily living, we usually allow around 6 weeks for a rotator cuff repair. And then by 4 to 6 months, you're kind of released to do most activity. We don't want you really lifting heavy for probably a year. However, interestingly, a total joint replacement, bigger surgery, open. However, it's a little bit quicker recovery. Okay, so those patients, they come in, they go to the hospital, have an operation, spend the night, and then go home the next day. We encourage them to kind of remove the sling for light activities in front of their body. Glasses, newspaper, and over the course of the first couple of weeks, they can often regain a lot of this activity. And then, for the next 3 months, they're pretty functional, and then they're released to most activity, almost all activity, by 3 or 4 months post-operatively.
Dr. Heinzelman, if someone needs to make an appointment with you, how can they reach you?
Well, they can call the office. I work out of the Fayetteville office. Make an appointment and get in and be evaluated, and we can start the process at that time if they need to be seen and start finding out what's wrong.